Diving Under the Influence by Dr. Mike Marshall, performed by Dr. Franz Cronier. Recreational scuba diving is enjoyable, and it's meant to be so. However, there's a fine line between fun-seeking and hedonism. And without an essential sense of responsibility and an awareness of the risks, diving can easily succumb to a culture of pleasure-seeking and self-indulgence. Diving, just like driving, demands a clear mind and technical proficiency at all times. For the same reason, diving under the influence of alcohol or other intoxicating substances is decidedly unwise, both for the diver and for their dive buddies. So here is a post-festive season reality check on finning under the fruits of fermentation and other intoxicating substances. Alcohol. It's common knowledge that alcohol impairs one's ability to perform various mental tasks. Reaction time, visual tracking, concentration, performance of simultaneous tasks, judgment, and psychomotor ability are all reduced following the consumption of alcohol. One would not expect any trained diver to deliberately dive while drunk, yet diving the morning after drinking the previous night may still mean that the diver is under the influence with an appreciable amount of blood alcohol. The liver has only a finite and individual dependent capacity to metabolize alcohol. So while the diver may not believe that he or she is impaired, the reality may be different. A study conducted on recreational divers doing shallow entry dives found significantly greater diving performance impairments with a blood alcohol concentration above 0.04%. These impairments were captured on videotape and were confirmed by standard dry sobriety tests. This is not unexpected considering that cognitive impairment, including functions related to attention and concentration, can be reliably measured when the blood alcohol concentration is 0.02% and above. Perhaps more concerning, however, is that the divers in the study were not aware of their performance impairments or of the increased risk of injury possible from diving while under the influence of alcohol. A review of over 150 studies on the effects of alcohol on cognitive performance found a number of observations that have direct relevance to the scuba diver. These include the ingestion of even small amounts of alcohol impairing performance, and these effects are noticeable even after one drink. The clearance of alcohol from blood, even at the predictable rate of about 0.015% per hour, does not necessarily equate to improved cognitive performance in the same time. Increased reaction time and decreased coordination follow a dose-response curve. In essence, the more alcohol is consumed, the more impaired these functions are. Persons who've been drinking alcohol consistently also underestimate its deleterious effects on their performance. And alcohol affects multiple attention tasks, like scuba diving, to a greater degree than those tasks requiring a single focus of concentration. In addition to impaired cognitive function, alcohol in excess results in a number of physiological changes that can endanger a diver. Acute alcohol intoxication can cause cardiac rhythm disturbances and can impair the heart's ability to pump. Both are significant concerns even without the added problems of exercise or the underwater environment itself. Also, alcohol can directly increase the risk of diving accidents. Dehydration, a common consequence of alcohol excess, is a well-known risk factor for decompression sickness. Alcohol also increases heat loss by vasodilation, which can lead a diver to suffer from hypothermia. Divers suffering from the effects of alcohol overindulgence are also more likely to be nauseous and vomit during a dive. This not only ruins the dive, but can cause dehydration, impaired attention, and increase the risk of a rapid uncontrolled ascent, all of which are known risk factors for diving accidents. Lastly, in common with the two drugs that we'll discuss shortly, alcohol can make the diagnosis of diving medical problems harder. While underwater, the soporific effects of acute alcohol intoxication are indistinguishable from the signs of nitrogen narcosis. However, upon surfacing, the common manifestations of alcohol intoxication, such as incoordination, sleepiness, nausea, and a headache, may either mimic or mask the signs of decompression sickness, and so delay its diagnosis and early treatment, or result in unnecessary medical interventions being taken. Class A and B drugs. According to research conducted by the Diving Diseases Research Centre, or DDRC, in the United Kingdom, 22% of divers admitted to using one or more illicit drugs while learning how to dive, and 21% of these divers admitted to using a Class A drug such as cocaine or a Class B drug such as cannabis between 6 hours and even up to 5 minutes before a dive. Cocaine is a stimulant with effects that appear within about 5 minutes and generally last for 1 to 2 hours, although the late phase effects can endure even for a few days after a binge. In simple terms, the acute effects of cocaine can be harmful to the diver in two ways. Firstly, the effects on the central nervous system, which include mood elevation, impaired judgment, and increased risk-taking behavior. These effects are incompatible with safe diving. Secondly, the stimulation of the cardiovascular system increases heart rate, blood pressure, and the occurrence of abnormal heart rhythms. In the presence of increased physical exertion, these effects have been proven to be risk factors for sudden cardiac arrest. Cannabis appears to be a drug of choice amongst divers, but the behavioral and physiological effects are harmful and may commence within 10 minutes of use and last up to 3 to 5 hours. These effects can significantly increase the risk of diving accidents. As with alcohol, cannabis causes altered perception. It relaxes inhibitions, impairs judgment, and causes mood changes, which all can compound the effect of nitrogen narcosis. Cannabis also causes vasodilation of blood vessels, which increases the risk of hypothermia. It decreases motor coordination, impeding the ability to perform technical tasks. Smoking either cannabis or tobacco increases the levels of carbon monoxide bound to hemoglobin in blood, thereby reducing the body's ability to transport oxygen, up to 10%. This can reduce the diver's capacity for exertion and so impair his or her physical ability to respond to an emergency. In addition to the acute effects of cannabis, long-term exposure can also present problems for the scuba diver. Just like smoking cigarettes, chronic exposure to cannabis can cause respiratory problems, like chronic bronchitis and sinusitis. These increase the risk of barotrauma and its potentially lethal consequences. It is worth bearing in mind that the possession or use of a Class A and B substance is illegal. Beyond the obvious threat of a criminal charge, the diver needs to consider how his or her medical funder might respond if such a substance is thought to have played a role in the cause of a diving accident. It is not inconceivable that payment for hospitalization or recompression therapy may be refused. So, although all this advice may seem conservative and even prudish and at odds with a fun-seeking culture of diving, divers should steer clear of using drugs and rather avoid or certainly minimize the use of alcohol during dive trips. The alternative is to put yourself and your dive buddy at significant risk of harm.